Welcome. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber. I want to thank you for joining us for this week's cross-industry update with Boulder County Public Health. Again, as always, please ask your questions in the Q&A or chat, and I'll ask them on your behalf. We're going to get straight to Boulder County Public Health so we can get updates on numbers, the course of action, and anything that you need to know as we move forward in this COVID-19 pandemic. Jesse, take it away.
Thanks, Corinne, and thank you everyone for joining us. We'll jump right in. Here, click on the right things. So we'll start with an epidemiological update, get into the dial status, and then talk about our public health order updates and tracking and tracing. So as I'm sure you're all aware, we are seeing increases in positivity across the community. Our 5-day average of new cases is climbing again. We had a steep decline after the outbreak in the CU community, but now we're seeing it generally across the community. As you can see on this chart, which divides the new cases up by municipality, it is spread across the county. We are seeing increased cases in Longmont, in Boulder, and in the past 7 days, about 32% of our new cases have resided in the city of Boulder and about 43% in Longmont. So I think last week we talked about that it was even across the two larger cities, and now it's again, we're seeing a little bit more in Longmont. I wanted to share these two charts, and I'll share the next one as well. The important thing here is to note that really after that outbreak among 18 to 22-year-olds in September, we're seeing all of the age groups together, and that's what you can see on this chart. And as you can see, we're seeing that all age groups increasing in cases, and so that's a worrying trend. It was quite slow before, and now we're just seeing it accelerate. In terms of key takeaways from these charts, the case numbers just are rising across the community, across the metro area. Case rates are rising in different age groups. Before it was limited to 18 to 22, and as you saw on that chart, it's across all age groups that we're seeing that increase. Unfortunately, we're also seeing hospitalizations increasing across the state. And we are seeing testing remaining high, and that's, we're also seeing a positivity, a very slow increase in that positivity rate. I've repeated this every week, and I think it's really important to recognize that we are still seeing a disproportionate impact on our Latinx community, and that's an issue for public health that we're trying to dig into, working with the community, working with our partners, and trying to use the data we have to target the right communities in the right ways to try to address that so that they can be safe. So I threw this in here. One of the things we often hear is that kids are not being impacted by this, but we are now seeing increased cases in children as well. And those of you with children know that there have been classrooms that have had to close, that sort of thing, schools that have had to close to try and address this. And I just, I think it's important to note in the last 2 weeks that we've seen that pretty heavy increase in cases. Jumping into the dial, here we are still at level 2. And just a quick review of the metrics that we use to assess where we are on the dial. New cases per 100,000, % positivity, and stable or declining hospitalization. And again, we're using these statewide maps that I think are helpful to understand the whole community. Our cumulative incidence rate is now up at 187.4, which puts us into Safer at Home level 3 for that metric. For positivity rate, we are still at 5% or below, so that's good. but again, we're seeing across the metro area people slipping out of level 2 into level 3 for positivity. And for hospitalizations, we're still seeing declining generally, but that trend is changing. And the reason that I say hospitalization rates are increasing and then this shows declining is a little bit of how they're differently assessed at our local level as well, or versus the state level. So this is a good sign, but that can change pretty quickly. So the big question, will we move to level 3? We're seeing this statewide incidence increase, and the state has made clear that they want to nip this in the bud as best they can, and we'll get into exactly how that will happen in a moment, and I think Lane will help me try and get exactly how that happens down so we can communicate that to you. But I think it's important to understand that this moving to level 3 is we're trying to protect the community and trying to reinforce the safe behaviors that'll help us stay at level 2. But level 3 is a possibility. And before we go to that, I just want to highlight in the charts I showed a couple weeks ago. I'm going to go back to those and look at just level 2 and level 3 and how they're different. And then we'll get into the process for moving. So really the big difference between level 2 and level 3 is the capacity of spaces. Schools will be impacted, definitely. Limited in-person capacity is available at level 3, but really remote or hybrid is suggested. But otherwise, we're looking at capacity changes, which will have an impact, I recognize. And so I don't want to minimize that, but it's important to note this. Now, one thing that I do want to point out here is this gyms and fitness. This is an old chart. This has been updated, and I hope that gyms are aware of this, and I should trumpet this out for everyone. At level 3, you'll be allowed to have 25% capacity up to 25 people, or up to 25 people, depending on the capacity of the rooms in your facility. So I think that's a big change that came out today from the state or last night, depending on when you got the email. But otherwise, it's really a capacity change. So now I'm going to jump to what the process is. And Lane, I don't know if I don't know if this chart is as super helpful as the language we got today, if you want to jump on that.
Sure. So there's a number of steps before we would change status, and our goal is to not have that happen. So if you recall, when we had the outbreak with the University of Colorado student demographic, our status never actually changed. So we began planning, we began cooperating with the city and the university, implemented a number of strategies, and we're able to really see those numbers plummet. But for the rest of the community, all the businesses, we never changed from level 2, even though the metric for case counts was telling us we were in stay at home, not just level 3. So the exact same thing will happen here if we're continuing to see the trends that we have. So we'll be in that monitoring phase really for the next 2 weeks, watching the numbers very closely. And if we're unable to make changes, that's when we would submit our mitigation plan. We'll be already working on efforts prior to that. But then we would formally, again, submit a mitigation plan to the state, have that review process, meeting with the state, assuming that they approve it, which we would be pretty confident that they would. Then we would have a chance for our mitigation plan to work. And ideally, it will, but it's going to really take the whole community to buy into this, because as you can see, Jesse showed, this isn't a CU, this isn't a young person's issue. It's across the community. So we really need people to be vigilant on the basic things that we've been doing for 6 months. And we know that people are tired of it, but once you stop doing it, you see what happens. So, and the real concern is the projections are that the hospitalizations across the metro area will overwhelm the system before the end of the year if the trends don't change. So So we really are on that trajectory for things to really become super problematic. But again, our goal is that no one will see that change to level 3. Ideally, we can right this ship again and hopefully change those efforts. Again, if we're not able to at the end of that kind of process, then there would be the decision by the state that we do need to move down the dial. So we won't be just making that decision arbitrarily. It will be because we're unable to make the numbers change. So the notice, I know everybody wants to know, when will that happen? And again, our goal is that it won't happen at all, but you do need to stay tuned, if you're trying to get advance notice, it's going to be based on the numbers. So if you don't see the numbers stay where they need to over the course of those 2 weeks, we'll still have our meetings very regularly. We'll be communicating broadly to the community. But ultimately, at the end of that process, there isn't an advanced opportunity to give people 2 or 3 days notice. Once we're at the end and we haven't made movement, that's when things will happen. So we'll likely know that. We monitor everything on a daily basis. But just so you know, that's kind of the timeline we're looking at is, we've got sort of 2 weeks right now to see if we can right the ship. And then if we can't, we'll be in the mitigation plan for that 2 weeks. And so if, again, things are not changing, then at the end of that is likely when we would move to level 3. Or if things get worse, it could move even further. But our goal is to have the community really get this and support it. Our businesses will be impacted by actions of people out in the community. We know that largely our businesses are doing a good job. We have seen an increase in outbreaks. That doesn't mean that they were from the business itself. It could be people coming to work sick and then potentially making their coworkers sick. But we know that the community needs to really understand the importance of social distancing and wearing masks. It includes kids, it includes kids' sports. So it's all those pieces. It's not limited to 18 to 22-year-olds anymore. This is across the entire community.
Thanks, Lane. Let me see here. And I think just to reiterate what Lane said, what can be done following the state guidance, limiting our group gatherings and following the same, public health practices that we've been following. That's how we do this, working as a community. Now, changing gears completely, and this chart I put in on Monday and may have less value now, but I think it's important to note that our, and this maybe speaks a little bit to the process we had and what that means in terms of our future mitigation plans if we need them. And that is the public health order that came out that impacted 18 to 22-year-olds in the city of Boulder. We were able to institute this plan that guided them back into compliance, and they are now in compliance with our with the dial metrics, and so they're under the same guidance as the rest of the community. So I think maybe think of this more as this is an example of the mitigation efforts working. So hopefully when we put mitigation efforts in place in the future, we can see the same success. So just wanted to jump in with an update to the group gathering guidance. Under safer at home, all levels now, the maximum group gathering, private group gathering is 10, consisting of 2 households. This applies only to events not under other guidance. So if you are having an event that is an outdoor event that meets all of the guidance for an outdoor event, then you can have more than 10 people. The guidance from the state in terms of restaurants, recognizing that restaurants are now wondering how to figure this out, is to try to ensure that tables are not more than 2 households. That's hard to do. We recognize that there's no requirement to check IDs to make sure everyone's from the same the same 2 households. But limiting group size is a great way to limit the number of households that are at the table. But suffice to say that it is not your responsibility to check everyone who comes into the restaurant, make sure that they're from only 2 households while they sit a table together. The other item that I wanted to bring up was, and this is, I think, something that we really want the community to get into. Both Apple, your iPhones and your Android phones are now equipped and able to join this exposure notification system that's being sponsored by Apple and Google, as well as the state. It's free, it's voluntary. Basically, if you sign up for it, it will use your phone's Bluetooth technology to figure out if you were anywhere near people who were sick or who have now been found to be sick. And it does not retain information about who you are. It basically just pings you if you are you've been in close contact with someone who's tested positive, and then gives you information about what to do about that. So I really encourage you. This has been something that our public health leadership has been working on, and this is a great tool for protecting the community, protecting yourself. So I really encourage you to sign up. You can see more information about signing up for it there, or just look for the exposure notification system for Colorado on your phone, whatever your Apple store or Android store is, to get these tracking systems. Really encourage you to do that. And then the last thing, I don't have a slide for this, but I just want to remind everyone that gyms, again, if we move to level 3, gyms are permitted to operate at 25 people in a room or 25% capacity. They are no longer closed, as was the previous iteration of the public health order.
And Jesse, I just put in the chat the 2 stipulations under that. And then I had sent out the press release this morning to anybody that's listed as a gym in the system. And if you didn't receive that, I'll resend that out today. But I sent out the new link to the new order, as well as in the chat, put in the number 1, the gyms, recreation centers, and indoor pools may operate at 25% capacity, not to exceed 25 patrons, whichever is less, and that outdoor recreational activities in groups of 10 people or fewer may occur, maintaining 6 feet distancing requirements with non-household contacts. So it also answered one of the questions that came in the Q&A. So
awesome.
Those were the pieces that were changed under level 3. Reminder, we are in level 2. That is if we were to move to level 3 under the gyms, and that is a change that occurred this morning. So
thank you, Corinne. And just to close out here, a reminder, please come back for these sessions. Obviously, we try to inform you up to the last minute what's changing. Things we do not control the flow of information or how and when the state gives us the information they have. But we try to get that out to you as soon as possible. And I just want to once again trumpet the work that Corinne does to get that information out to you in email form as soon as it comes out from the state or from the county. So definitely look for those emails. They're full of great information, and they're up to date more than a weekly webinar can be. So I really appreciate that. With that, please email us if you have questions or concerns. If you have violations or are concerned about violations, definitely call the call center. They're still operating, and they are happy to pursue those. And we're happy to get those and talk to our business partners when the issues rise. So with that, happy to answer any questions.
So I'm going to start actually with the exposure notification system. You had a link up there, but I put a link in the chat that's actually the addyourphone.com, which are the instructions on how to do it for iPhone or Samsung type phones, the Android phones. It's as simple as sometimes going into your setting, and it's actually a new feature under your phone that you just activate it. You don't even have to download anything anymore. So I put that into the chat, and I sent it out in yesterday's email, but I will send it out again. We're also asking all the local chambers and EDCs to send out the information because it is a new tool that's available. But you also have the link up here. That's the link that at the state site, either link. But the addyourphone.com is just instructions on how to do it on any type of phone. All right, so we have quite a few questions that came in, and this week I can actually see the Q&A. I
Awesome.
hardwired in, so we shouldn't have the same problem as last week. So people are asking questions about capacities. How do you determine a capacity of a space?
Yes. Okay. It depends. So for the majority of your businesses, your capacity is defined by the fire code for the space, and then you take 50% of that. For gathering, so anything under the outdoor or indoor gathering guidance, it is defined by the space calculator. And that space calculator, I see that someone's looking for where that is. For retail stores, again, that's your fire code capacity, not the social distancing space calculator. But the space calculator can be found on our website, and it is also.
I just put it into the chat.
Yay! Thank you. And also, if you go to covid19.colorado.gov, that link will be at the top of every page for the sector that it is useful for. So if it's not useful for your sector, or if it's not required for your sector, it will not be on the page for your sector.
So if it's a capacity of an office, if it's a capacity of a retail space, a capacity of those, that's based on the fire code. But when you're talking events and some of those, you're going to use the space calculator. And if it says 50 people, but the calculator, your space isn't really big enough for that, you need to go with the smaller figure, correct?
Yes, absolutely. Absolutely. Yeah, almost every one of those says, X% or some number of people. Always the smaller number is the number that is correct.
So when it's when you move into level 3 and it says 25% capacity or 25, whichever smaller, your smaller number may be 10. Yep. And then 10's your capacity.
Yep.
All right, so there's still some confusion as to when the earliest we would move into level 3 would be, Lane. I think people are still confused as to whether this is our 2-week warning or if there's going to be a warning or what kind of notice we'd get. So if you could just, with the caveat that there are still uncertainties, the governor could, there could be other orders that come out, but can you just, maybe just define that timeline again and just give people that idea?
Yeah, I mean, basically we're going to be looking at the next 2 weeks. Do we need to submit a formal mitigation plan or not? And so if we get to that point where we need to submit a plan, then we're in that phase that we have to see significant change. And if we don't, then we potentially are moving into the dial. So as of yet, we have not had to submit a mitigation plan. So once we are in that place, then we're really need to see change pretty quickly.
And we're different than Denver because Denver's numbers were much higher than ours for the past couple of weeks. Yeah. So when people saw Denver go to dial level 3 yesterday, we had been at much lower numbers than Denver and Adams County for the last couple of weeks because we had reduced our numbers after the CU outbreak for quite a few weeks.
Yeah. And I think, if you recall, Jesse had been showing that when we started to see significant downward trends, the rest of the metro area was seeing upward trends. So we were concerned about that because of the potential spillover, but we quickly went from kind of the worst county to the best again, kind of where we had been prior to that outbreak. So that it had been happening in the other areas for weeks, which is why now you're seeing them finally change their dial status because they have been unable to really change the numbers. So again, hopefully we can change them once again and not have that happen.
And when they had, good numbers and we were under a mitigation plan, which our mitigation plan included the stay-at-home orders and the quarantines for 18 to 22-year-olds, they weren't under any of those. So we had those mitigation plans in place, controlled our numbers, didn't have to change our dial status. They had to change their dial status, which is what happened yesterday. And I think there's just a little bit of anxiety among Boulder businesses that we were going to follow suit.
Yeah, again, it's not an instant. As soon as you see numbers that are in those categories that you instantly move, there is a process to start to work on planning and again, then formally submit a plan to the state. So it doesn't happen instantly. And again, right now, we're only seeing that one metric drive the change. So hopefully we can still see that come down, but as long as we're keeping the other two metrics, it still gives us some ability to negotiate with the state saying, hey, our hospitalizations are not a problem right now. We're not seeing increases in our positivity, at least beyond what are still within the good levels. So again, we want to really keep an eye on all the metrics. So it'll be that ongoing effort.
Do you know what risk factors based on where you're seeing the positivities are causing the jump? Is it a lack of mask wearing? Is it groups? Is it the personal get-togethers? What's causing the jump in numbers?
Yeah, we don't have a definitive answer. I think people that are sick often, it's not clear that there's one source to this. Again, the likelihood is that people are having gatherings, people are not masking, people are not socially distancing. I know I'm personally aware of a lot of those things happening. So our businesses, I think for the most part, have really been doing a strong job. So I know they are really concerned that, hey, we've been doing all these things and yet we still might go backwards. And it isn't fair. But it is the responsibility of all of us to make sure that people get it. So when you know that there's parties happening, let them know that your business is on the line. So their decisions have impacts broader than themselves. But we don't have definitive answers on where people are getting sick, because people usually have multiple exposures. So it's not clear where they potentially got sick.
Especially with so many people being asymptomatic and not being able to necessarily trace that.
Yeah, it's little bits of all of it. People that are supposed to quarantine and isolate may not do a great job of that. So we've heard households quickly getting sick because the person who was sick didn't isolate, effectively. And then the rest of the people who were supposed to be quarantining may have then exposed other people. And that's, again, how the virus moves. So once you are sick, you really need to take this seriously and stop that spread. And again, all the different pieces we've been talking about for months and months are still the risk factors. So
maintain your distance, wear your mask. We've heard it many times, and right now with numbers going up, with the weather getting worse, just even recently in Boulder County with fires and us having to move indoors, it's becoming more and more relevant. Is there a scenario where we would go to stay at home without a level 3 status first?
Yes, if the numbers, jump across all those categories to stay at home and all our mitigation plan efforts are not working, it isn't really a different mitigation plan to stay in level 2 versus level 3. It's the same mitigate. We don't want to move at all. So our plans are to always try and keep things down. So again, if things really keep getting worse and we do a mitigation plan and things get worse and it puts us at stay at home, potentially we move to stay at home versus level 3. So it doesn't move one stage at a time. It moves based on what your metrics are forcing things to be. So.
Okay. If it was decided that we had to move to level 3, you probably would know during that mitigation period where we would be able to give some notice to businesses so that restaurants would know that they probably need to prepare for 25 people, or that they were probably going to have to move towards reduced capacity in the near future and be able to prepare. Are we going to have some notice?
I mean, it's difficult to say. We will know what our numbers say, so we will know if there's a threat of that happening. But we still won't know if the state ultimately says you do need to move your dial or not. So again, if it's one metric and we're really close, my hope would be they wouldn't make us move, but it's going to be the trends, are we seeing things improve, or are they staying bad or getting worse? So that'll be the best indicator of what likely will happen, but we really won't know until the decision is made. But
We'll know we're in a mitigation plan though. So
Yeah,
we'll know that our metrics need to go down. Yep. And at that point, we can let businesses know that we need our metrics to go down. We're in a mitigation plan. We're at threat of going to level 3. If you just be prepared type of thing, that's the best we can do at that point.
I mean, we need it to start happening right now. We don't want to get to a mitigation plan. So that's again why we're sharing these messages is, waiting till you're in trouble to then try to do something is often too late. It takes quite a while to start to move the needle in the right direction, especially as the disease moves amongst people. So.
I think the answer to this is no, but I'm going to ask anyways. Is there signage that restaurants can post that talks about the 2 household groups?
Not produced by us, I don't believe.
No, we haven't created that. I think
I might be able to get one made. It may not be right away, but we might be able to get one made. Is it high priority? We'll see if we can put that on the list.
But people are welcome to certainly post whatever makes sense. You certainly can also limit the size of the tables you offer. You can say we don't have tables greater than 4 or 6, whatever you want to do that starts to not allow people to bring big groups to your restaurant anyway. I mean, you're already limited as it is. So I think that it's up to you how you want to further address that. But certainly people with masks off all at the same table, that is a risk. So we know that.
All right. So someone wants to clarify on numbers. The governor announced that the state is over 5% on the one metric, that the state is that. But Boulder County is below 5%, correct?
Correct.
Yeah. Yep.
So again, other than some of the decisions the governor has made about the dial, what happens across the state, it influences our potential to see more disease because we know people live one place, work another place, recreate somewhere else. But our dial movement is based on our Boulder County data. So it is important to know what's happening across the state. We monitor that closely. There's a lot of contact. There's meetings with the directors across the public health systems. But again, we won't change status based on what happens in Denver. It will be based on what happens in Boulder County.
Did Denver go through the process of submitting a plan to stay at level 2 and then fail to meet that, or did they go to level 3 without a review?
That's my understanding, but I have not seen their plans. I wasn't part of that process. And I know Jefferson County's in that phase right now of submitting a plan.
Actually, when you go to the state website, there are little dial pieces on the map, and it has little indicators if they have stricter orders or if they have a mitigation plan. You can actually look at the different mitigation plans in different counties right now that are under mitigation plans for the counties. It's on the state website. Because the outbreak we had when it was the 18 to 22-year-olds was a very concentrated effort, and it was something that was, let's quarantine a group or let's do this. Because this is more widespread across the county or across age groups, are there any ideas of specific tactics that would need to be taken to bring our numbers down, or is it that would need to be put into a mitigation plan, or are we not even there yet?
We haven't looked at any kind of stay-at-home orders for specific demographics, that I don't think that'll be any component of our efforts. You know, I think the governor has set only 2 households getting together for personal gatherings. You know, that I think is a strategy to try to avoid people having larger gatherings that are potentially spreading things. Yeah, I think this is going to be challenging because largely we just need to go back and look at all the pieces that we need to be in place and figure out which ones are breaking down. And it's difficult because once the case investigations aren't really producing a clear answer of how people are getting sick.
How are hospitals preparing for this predicted surge in cases?
Tell you that's another real concern, is that the staffing levels at hospitals has been dropping dramatically. And so their ability to handle things is very different now than it was months ago. So that's the other confounding piece to seeing increased hospitalizations, is hospitals' ability to staff and deal with disease has become more and more strained. There's people that are, you know, they've just lost staffing. So that's really concerning. People have burned out. You know, this is a difficult work to be involved in, and people have been doing it so long, and they're at high risk occupations. So I think those are big concerns. We continue to meet with our partners within our systems to try to look at those issues and help figure out how we can support them and what are strategies to deal with that. But it's a real concern on their capacity. So again, I don't think we're at the same level of overall capacity that we were earlier in the year. So this trend within the state is incredibly concerning.
Okay. We have a question about indoor basketball courts and all of that. I sent them the link directly, but remember we're in level 2 right now. So look at that and then know that moving to level 3, you'll look at those guidances there. Are there any changes with testing recommendations for healthcare providers?
No, there's
Not that I'm aware of.
changes.
All right. So Jesse, one of your favorite questions, can you share Halloween recommendations for trick-or-treating?
I don't have something at the ready, but if you go to the state website, and I think Corinne has shared it the last couple emails, there is state level guidance for Halloween for trick-or-treating. You know, just on I will add as a personal note, group gatherings are not always a great idea. Even if they're well managed, that can be hard to do, especially with kids. So, you know, manage your risk is what I will say about that. Manage your risk.
And I'll put that into the chat in just a minute. So there's a question again about gyms. You know, gyms closing. So if you're at level 2, which is the current level, every county is at different levels. So right now we know that Denver and Adams moved to level 3. We're currently at level 2. Jeffco's at a different level. So if you're a gym that operates in a different county, you need to know your level, because we actually have some people on here that are in different counties. Your capacity is different. And I put into the chat that the decision was made this morning to change that level 3 capacity. So right now you have a level 2 capacity, and then there's that level 3 capacity. It used to be that you had to close, but now there's that level 3 capacity that's now 25% or 25, whichever is smaller. But can a county create a stricter guidance that closes a specific business type down?
Yeah, that authority is there. Municipalities have authority, and then counties could put a public health order in place. I don't know of any that have chosen to do that. I don't think we would look to do that in Boulder County. So that's not a threat or concern right now from us.
So if we move to level 3, The idea for a gym is that it would be 25% capacity or 25, whichever is smaller. So
As of right now.
as of right now, as of this morning, the most recent, which was a positive. I've heard from many gym owners that was a positive change from the you must close. I know that that was a very stressful situation for a lot of gym owners and gym employees who were worried about that moving to level 3.
And one thing, I don't know that this has come up as a question, but I know we've had this come up a number of times in the past, is if we have to move to level 3, can different businesses petition to have a variance because they are doing, you know, above and beyond practices? And the answer is no. There is no variance provision for people in level 3 to get variances to do more. So that's why we don't want to even have that happen. We need to avoid that altogether. Because again, I'm not saying people couldn't justify. I know I've heard from different businesses of the extra above and beyond protocols people are putting in place, and those are still great things to do, but it isn't going to allow you to get a variance if we have to move to level 3.
So again, the capacity question, I think there's still question as to whether you use the fire code versus the calculator. I think in this case, not knowing who this person is because it's an anonymous question, Jesse, your recommendation would probably to look at what sector you're in.
Yep. Look at the sector you're in. On covid19.colorado.gov, it will say whether you, if it says X% of capacity and doesn't give you a link to the social distancing calculator, then it's their percentage of your fire code. And I see a question on here that says, what's the resource we can refer to on capacities fire code? If you own your building, it'll be posted. If most spaces, if they're publicly accessible, have a placard that say what the fire code capacity is, and then it's whatever percentage of that is for your sector. If you have a, you know, if you're a unit within a larger building, definitely speak to your building management to see they have to have a record of what the capacity is for each space.
So for personal services, and when you have your individual rooms and you do stuff in those rooms, how do you, such as massage, how do you calculate your capacity for those spaces?
So each room will have a fire code capacity. I that's all I can tell you. I can't give you an answer because I don't know what the size of the space is, and I don't know what the fire marshal said. But each room will have its own fire code capacity.
You also want to maintain social distancing. You also want to maintain, not have massage tables next to each other.
Yeah, and I think oftentimes that doesn't present an issue, but if for some reason there's a large where people are separated by curtains, I know sometimes that like the massage schools, they offer sort of discounted massages for the people, but most of the times it's one patron, one person working in a room, so it sort of doesn't become an issue. But if for some reason you have services where there's multiple people in there, more like going to a salon or something like that, where there's multiple booths all in the same room, again, those need to be spaced appropriately. So
making sure you follow, it's not just capacity, it's following the guidance, the social distancing, the cleaning, the masking, all the other pieces. So that's beyond the dial limits your capacities, but you need to make sure you're following all the other guidance as well within your sectors. Speaking of dial, can you bring up the dial slide again? I think it's the one that shows the different capacity.
This slide, or
I don't know which one, Lisa. I think it's this one, or so there's a different one, and then there's the next one.
Yeah.
And I put into the chat, the very first link I put in the chat was the link to the Boulder County page that actually has this on there. It doesn't have the updated chart with the new gym order.
You know, and another thing that's important related to events or things like that is we're always cautious in people planning things that could be changed by the time their event or activity takes place. So you're always subject to wherever we're at currently. So just because you planned an event that said you could have 175 people outside, if we're suddenly at stay at home, your event is canceled. So if we're at level 3, you're going to be down to 75 people. So it is important to have those kind of contingencies, knowing that things could change.
If the businesses aren't the reason for the spike, how will closing the businesses help the numbers go down? Wouldn't that just force people to gather in uncontrolled environments?
I'm not saying that there is no role that businesses are playing. We think most businesses are doing a good job. We have seen increases in outbreaks across businesses, but it isn't necessarily definitive that the businesses themselves are the risk factor. We can't say that one way or another, but we've definitely seen increases in outbreaks across businesses too. But the dials are limiting multiple facets of what's happening in our communities. So again, there is a risk for people going out and being around each other in whatever setting it is. But again, we can't definitively say it's because of gyms, it's because of this, it's because of that. We're seeing kind of instances across the board. So again, unfortunately, as things go up, it ratchets down across all sectors.
And let's say the governor announces a statewide move to level 3. And if Boulder County was at level 2, would we immediately have to move to a strict measure, or would we get a grace period?
There will never be statewide movement of the dial. The dial is based on all the local metrics, and they're widely different across the state. So there would never be a state movement of everybody is in this level unless the data across the entire state moved everybody to that level. So again, it's based on what's happening within the local area.
What he would do is he does statewide orders of specific types of orders, like masking orders or personal gathering orders, or, you know, those types of orders. He still has bars closed, for example, those types of things.
Correct. And making changes to the dial itself, but to tell everybody that you're now in level 3, even if the data doesn't say you're in level 3, that is not going to happen.
Okay. All right. Lots more questions. So I think there's a still, can you go to the 3? I think it's the slide before this one, or 2 before this one. Actually, it's the metric slide, the 3 metrics that we're tracking. Yep. Okay, so this one right here. So, so I think there's the question about the 5%. I think it's the same person that asked the question about the governor said we're above the 5%. Mm-hmm. That's one of 3 metrics. It's the percent positivity. And within Boulder County, we're below that 5%, which is the percent of tests that are coming back positive. But it's only one of 3 metrics. And a lot of the metrics that are concerning across the state have to do with the new cases. And the one that Boulder County is struggling with is the new cases per 100,000, correct?
Correct. The 2-week cumulative average is the one that we, right now, we're at 228.6. So when you look at that, it's starting to be more firmly in the middle of level 3. But for the 2-week average positivity, our current is 4.6. So we're still below 5%. And then for hospitalizations overall, I think that's mostly stable. As Jesse mentioned, there's challenges because there's 2 ways that they're looking at that. One is what is happening within the hospitals within your county. And then one is looking at where residents live. So again, if someone lives in Boulder County and goes to a hospital in Denver, depending on which way that's being tracked, you're seeing increases in Denver versus increased hospitalization of Boulder residents. So there's some challenge with that. And then not all hospitals are reporting into the same system. So we're in close contact with all of our hospitals, but so there is still some concern about what's happening. Overall, though, things are still mostly favorable there, but we're watching that very closely. Across the state, overall, there are increases in hospitalizations pretty uniformly.
Could you clarify where museums fall within the categories of
You'll have to give me a second to take a look at the
or it might be something we could take offline. I do know who wrote this, so I could take it offline if we need to.
No, you can, yeah.
Lane, we have apparently Energized Colorado is showing out of stock on KN95 masks. We have some, owners of some businesses who are feeling a little vulnerable and want to know if there's other places, recommended places to buy masks. Do you know of any other places to buy masks?
I don't have a list of places that do have stock. I know that has been an issue in the past, but we don't have a listing of suppliers at this point that we can kind of recommend. One of the things I would certainly say is, depending on what the business is, of looking at whether you do or do not need those, and then certainly looking at how you're using them and when they're discarded and when they're not. Obviously, healthcare settings is really when they're needed and when they need to be discarded. If you're using them in other settings, it may or may not need to be discarded immediately, as a single use, because you, first of all, are not required to have them. So you're sort of going above and beyond. And then again, you need to look at, is that really an investment you need to be making?
Let's see, were you able to find it, or are you still looking?
Still looking, but I'm thinking, this is something that actually came up earlier when at the beginning of Safer at Home. And museums sort of, it depends on what the service if they're doing events.
Or retail. Some of them have been looking at retail information as their category.
So it's by their space, what they're doing. So if they're doing educational events, then they would fall under education guidance. It's complicated. And I definitely recommend, if you have questions about how to operate your space as a museum, reach out to Boulder County.
You go back to your contact information at the end?
I will. Give me a moment here.
And often some of those types of businesses have multiple categories. So your office space where your staff work falls under an office space. Where you have counters and you're doing customer service, that's more retail. If you're doing educational events, you're following more of that. So sometimes businesses have to follow multiple categories. We've seen that with some services where they have people out in the field, they're going to follow that field services. But once they have a retail space, that follows that. And then if they have a dedicated office space, that follows that. So they have to follow sort of multiple different sectors depending on which part of the business you're talking about.
And this person said, yes, please, thank you. Because we even have personal services who have the retail spot, they have the hair. They've all had to follow different guidances, the limited healthcare with their office space. We've been navigating this all along, and I think it's the real estate companies who have their office and their field services. So you're going to have to look at the different guidances, and if we move along the dial, looking at your different movements of those different. We've also had, if you operate within different counties and those counties are at different levels of the dial, knowing those different pieces. We understand it's a difficult situation right now for businesses. And I think that these webinars, having the information and a person to contact to ask questions, that's what we want to provide you. Be able that opportunity to ask those questions and get clarification. All right, I'm trying to make it through here on these questions. Is there specific guidance for keeping open and cleaning locker rooms?
So check the covid19.colorado.gov for recreation centers. They need to be cleaned regularly. The guidance, and I'm doing this a little bit out of memory, but the guidance says to set up the locker room such that you can have 6-foot distancing between people using lockers. So you need to close every couple lockers so that there's space, and they just need to be cleaned much more regularly than you would in normal times. Locker rooms are very hard. I know there are some gyms that have closed them completely, just making it, you need to show up ready to work out and then leave. That's, obviously making sure bathrooms are accessible is important, but locker room facilities are a difficult thing.
I just put a link to the recreation site on COVID-19. Someone said that, they personally had a scare in their household and followed the correct protocol with their employment, that they had symptoms and they went and got tested. They tested negative. Did they jump the gun on getting tested? Should they have quarantined for longer? What's the protocol for that when you show symptoms?
I mean, if you're sick, it is wise to get tested to rule out COVID. If you're not sick and you were exposed to someone and you need to quarantine, you shouldn't get tested at all, because there's no way to test out of quarantine. So again, if you're a high risk exposure, you need to quarantine. And the challenge is you could become sick up to 14 days. So that's why you're quarantining for 14 days. So just because you tested negative day 5, 6, 7, you still could test positive 2-3 days later. So again, the testing is really based on people that are symptomatic. And if you are symptomatic, unless you have multiple exposures where you have multiple respiratory diseases at the same time, it is wise to still get tested and find out if you have it or not, because you don't want to continue to expose people. And again, regardless of what you have when you're sick, you shouldn't be exposing yourself to anybody. That's how all respiratory diseases are spread, the same way as people that are sick exposing other people. So it is just a good idea not to expose yourself when you're sick.
Okay. So we have a couple tennis and swim clubs on here. And there was the change in the gyms that allow the 25% capacity. If you move to level 3, the 25 or 25% capacity. But it says no indoor league sports when you move to level 3. Were there any changes to leagues? There were no changes to that specific rule.
I see that question, and a league would not be allowed to operate indoors. The goal is to allow for pretty much individuals or trainer-led exercise to occur. That's I think the goal there. But it's pretty clear in the order that at level 3, both youth and adult league play is not allowed indoors.
You can still have instructor-led indoor rec classes indoor in a small groups.
What the order, because personal services are permitted, yes. And that's what that 25%, 25 people or 25% comes from.
Okay. All right. We're getting there. For the exposure, I don't know, do you guys know much about the exposure notification system enough to be able to answer?
I saw that question and I emailed our attorneys to see if I could get an answer before the end of the session today.
Okay.
I don't know if I will. Definitely check the website. And I guess I should mention what the question was, whether a person who gets a notification that they were exposed needs to quarantine. I would recommend following the directions that you get when you get notified. It'll probably say contact your public health authority. And then 2, whether the Families First Coronavirus Recovery Act will cover employees who need to quarantine. I don't know that answer. That's what I've asked.
And that depends on if you qualify as an employer under the FFCRA
And I know there's state level support as well, and both of those, I think, speaking with an attorney is probably your best bet to see what that would mean. I do, because I don't know what triggers would cause you to be able to access that funding.
Yeah, and it's a good question. If an employee signs up and it says you've been exposed, if they're automatically required to quarantine, and that'll be something that we can bring. If we get an answer to that, we'll let people know. We also don't. I don't know if the app says how long the user was near someone that tested positive because of the whole 15 minutes within 6 feet of somebody rule. How will we know if you submit a mitigation plan? Will businesses or others be notified that Boulder County has submitted a mitigation plan?
Yeah, we'll share that through Corinne and at our weekly webinars.
Somebody's confused about quarantine time. On the website it says 7-day quarantine. What's the quarantine time if you've been exposed?
It is 14 days. There's a 7-day note in there, and basically what that says is if you want to get tested, you should wait it to 7 days within your quarantine. And I don't know exactly what they're trying to get at there. I think Lane really explained it really well. If you are sick but haven't had any contact, you should get tested to see if it's COVID-19. But if you have been exposed and you're required to quarantine, just quarantine. You don't need to test. Just spend the 14 days.
We have someone who's suggesting the occupancy calculator formula reflect the percentage capacity based on the current level.
Yeah. Do you want to?
But you guys don't actually create the percentages. It's the state that's creating those percentages.
Those percentages aren't related to the space calculator. The space calculator really does. It just tells you based on it tells you based on a space like a social distancing space, 12 square feet around each person. Sorry, I'm having trouble explaining this. But the capacity percentage has nothing to do with the calculator. It is fire code based, and it changes based on your level. You just need to know your fire code limit in your room and then apply the percentage that's given by the state.
So to make it clear, the social distancing calculator should be used for indoor and outdoor events and large space restaurants over 7,200 square feet to figure out your capacities.
Yep.
Everybody else should probably look at their, in most cases, fire code. Look at your other your guidelines, but look at your fire code for your capacities. And that social distancing calculator really is looking at giving each person 144 square feet, so 12 feet around them, so that there's room to allow, that 6 feet and then movement between people. And that's that more of that event type feeling.
Yeah, sorry, 12 square feet is way too little. It's on. Yes, sorry.
Okay. All right, let me see. I think we're almost there. There's a question about if any businesses are having luck purchasing outdoor patio heaters. That is something I've heard that a lot of people are out of. I've heard like Costco's and Amazon's are out. I heard, places like McGuckins and some others were getting some in, but they were some of the local hardware stores were getting some in, but they were also selling out of them quickly. I would call around. I know that people have been purchasing those for a while. If I hear of any, I will let people know. If you are on this call and you have some or have heard some, please send me an email and I will let those on the call know. They are in high demand right now. So there's a question about private schools, whether or not private schools are required to wear masks for students.
Yes.
Yeah, based on age of the
So it's
student.
a 11 and above.
Mhm.
I think
Did Denver,
there's recommendations that younger kids wear them. It's not a requirement, but it's certainly encouraged.
did Denver change to level 3 without any notice? Or did they reduce capacity overnight? And did they reduce capacity overnight?
I'm not sure. I'm not receiving communication, so I don't know what they communicated across their community. I don't live in Denver, and so I'm not sure.
Huh. Someone said they had an employee that came into contact with a positive in person and was told by the testing site he went to that he should quarantine until his test results came back. Then his test was negative and he was told by the testing site he could come back to work.
I don't think the testing site should be giving out quarantine advice. But Lane, I don't know if you have any background on that.
I mean, we definitely would encourage people, again, who are testing themselves to find out if they're sick, to quarantine until they get their results back. But if you need to quarantine because you've been exposed to COVID-19, you need to quarantine. So there is no testing out of that. So that could just be mixing up pieces of the information that were shared, that yes, someone who's waiting for their test results should not go out, because if they're positive, they're exposing people. And then once they get their results back, depending again on why they were testing, they may be able to go about normal activity. Again, if they have cold, flu-like symptoms, to get tested and show that they're negative, seems like they have a cold or flu or something else. But again, if you're exposed to COVID-19 and now you go to get tested to show you're not, there's really no way to do that and get out of the quarantine.
And you wait at least 7 days to get tested into that quarantine so that the viral load, someone said the viral load is high enough in your body to test accurately, but there's no guarantee until that full 14 days as to whether or not you have the virus.
No benefit in testing once you need to quarantine. So,
and then someone said they missed some of the presentation. When is the state discussion with Boulder County about our numbers? Is that been scheduled? Are we even on the books to have a discussion with the state?
no, not yet.
The earliest we'd probably schedule a discussion would be next week, correct?
Yeah, next week or the week after. So we just have kind of hit that trigger. So I think we'll be looking over the next 2 weeks to see how things are going and if we're able to make movement, or if we need to schedule a meeting and put together a mitigation plan.
Are there any protections or screening plans in place for people that go to vote?
There's a lot of efforts. I mean, we encourage people to do the mail-in ballot. That's always your safest, or drop it off yourself. But if you're going to go vote in person, they're putting a lot of protocols in place to try to address those risks.
Okay. And then lastly, there's a question as to whether or not if we moved into more restrictive orders, there'd be more support money for businesses out there. And the answer to that is this is, it wouldn't be from Boulder County Public Health. And there's currently some funding sources that are still open. I believe today is the deadline or for Energize Colorado. There is an unincorporated Boulder County deadline for some CARES Funding Act. There's some other small funding opportunities out there, but I'm not sure if there's any specific. 26 was the deadline for the GAP funds. Sorry, that was it's passed. But if I don't think there's any other specific funding that would go into effect if we went into stricter or stay-at-home orders at this time. But we never know. So thank you for whoever just corrected me on that one. I appreciate that. 26 was the deadline on the Energize Colorado Fund. All right, are there any other questions out there? We did go past, but we had a lot of questions today. All right, we had a lot of people on today's call. it was double the normal amount. We had a lot of questions. We appreciate both of you taking time today to answer the questions and try to clarify where we are. We're kind of in that limbo. Our numbers are going up, but we've seen the counties around us changing levels. But the key message is we all need to do our part to get the message out that we need to continue to socially distance, wear masks, keep those numbers down, because it's going to affect all of us. And we need to stay strong through all of this so that we can keep our businesses open and so that we can all stay healthy. So on behalf of the chamber, on behalf of the other chambers and economic development, the municipalities, I want to thank you guys, and I'll see everybody next week. Hopefully we have good news and we continue to stay open.
Thanks, Corinne. Thank you, Lane.
Thank you.
Thanks, everyone.